Hello guys, hello family, hello friends, this is Dr. T and welcome to Clinical Medicine with Dr. T. So guys, yeah, this is our first video for the year 2022, our first teaching video for the year, and I'm looking forward to this year. I hope we're gonna keep growing and keep supporting each other as we go through this. So I want to thank you so much for subscribing and actually being a part of my channel. Thank you to those who are liking. Thank you to those who have subscribed, who are liking. And please, if you have not subscribed, consider subscribing. And by the way, YouTube is telling me that out of the 100% of the people that watches my channel, only 60% have subscribed to my channel. So there's like 40% who consume my channel, if I may say, who watches my channel but they don't subscribe to my channel. So guys, please subscribe to my channel. It's very motivating for me, and yeah. So, and I would like to get to a second 1,000 as quick as possible. So please guys, subscribe, share and tell your friends about it. My aim is to actually have all medical students in South Africa know about my channel. I want to talk about diabetes and food. Diabetes and food. So I'm gonna focus more on the I want to talk about the link between diabetes and food. I'm not gonna talk about diabetes as a disease in terms of like the clinical presentations, pathophysiology and all of that. I'm not gonna get into details how to investigate it. No, I'm not gonna talk about that. There's a video that I did about what to do when you've got a diabetic patient at the clinic. What are the things that you look at and that type of thing? What are the tests that you need to run? So please watch that video. It's under internal medicine folder on this channel. So the reason why I want to talk about this, and I'm gonna try very hard to use plain English, because I would love, even for those people who are not in the medical field, to actually understand what I'm talking about and share with their families and friends. And yeah, so when you've got someone who's got diabetes, what is important, and I'm talking about both type 1 and type 2. So what is important when they've been diagnosed with diabetes, what you want to do is you want to control their blood sugar. You want to control their blood sugar. So control their blood sugar. And controlling a patient's blood sugar, there are 3 things that we need to look at there. We need to look at the diet. We need to look at the drugs. We need to look at exercise. These 3 things, they work together in controlling the blood sugar of the patient. I'm not going to talk so much about exercise, so I'm going to put this thing, because not everyone is keen on exercising and blah blah blah, but I'll just tell you how exercise helps when it comes to controlling blood sugars. For now, let me say Diet is the most important when it comes to this. It controls, when it's taken care of, it can control the blood sugar. So it contributes about 90% in terms of controlling the blood sugar of the patient, about 90%. And then the drugs is only about 10%. I mean, most people do not exercise. Most people, they don't exercise because of so many things. Like, I've got patients who've got osteoarthritis, who are obese, who are old, that cannot really exercise. So I'm gonna put exercise. So if you can exercise, you might find that your exercise is gonna help you about 5% or 15% or 20%, depending, right? So I'm gonna put exercise out for now, but it's still important. So diet, because it's about 90%, it contributes about 90% in terms of controlling the blood sugar. So it's very important. And unfortunately, most people do not really pay attention to the diet as they're supposed to, and they end up having blood sugars that are not controlled. Now, if you are able to control a patient's blood sugar through this, what are you gonna be doing? What you're gonna be doing, you are gonna be able to delay, or let me say to slow down. You're gonna be able to slow down the disease progress. And if you slow down the disease progress, that means you will delay the onset of complications. You will delay the onset of complications. Right? And if you go to that video that I spoke about, you will find that I did speak about the complications of diabetes and what investigations needs to be done. So, as we know that the complications are divided into microvascular and macrovascular. Right? So, controlling a patient's blood sugar, unfortunately, many people, they think that as long as you are taking your treatment at the right time, the right doses, your blood sugar will be controlled, but it's not the case. It's not the case. You need to help the drugs with a good diet. And we are going to talk about the good diet. That's what I want to talk about. What is a diabetes friendly diet? So, this is what you want. You want to delay complications through controlling blood sugars. And when your blood sugar is well controlled, you will minimize the chances of being admitted with the acute complications of diabetes, like those hyperglycemic complications, like your DKAs and your honk and all those things, right? So you also minimize hospital stay and all those things. Now, when the blood sugar is well controlled, it means that because you have slowed down, or you are slowing down the disease progress, it means that patient can actually take one drug, can be on monotherapy for years, and The drug of choice that patient has started on is metformin. I'm just trying to check to think now. I've forgotten the class that metformin belongs in. It's the only drug in that class. So when a patient is diabetic, they've been diagnosed with diabetes, it's usually depending how aggressive it is when it was picked up and that kind of a thing. So, but usually the drugs would be the drug of choice would be metformin. And if the blood sugar, if the patient is taking the metformin and they are taking care of the diet, they can actually stay on metformin for a number of years without having to have a second drug added to their treatment. If it happens that they need a second drug, it's usually that's now when you get to the dual therapy. When you talk about your sulfonylurias, your sulfonylurias are drugs like dionyl, drugs like glycomine, glibenclamide, glyclazide, those drugs, ne? One day we're going to talk about how they work and that kind of a thing. And if this fails, the patient is usually put on insulin. Most of the times, when the patient is on insulin, they will combine with metformin. It's very rare to find a patient on insulin plus a sulfonylurea. It's not really recommended, but there are specialists who do it, but it's not really recommended because of the risk of hypoglycemia and that kind of a thing. But we're going to talk about that when we talk about diabetes. So now let's say a patient is started on metformin and then they go for about 5 years, which is possible, 5 years on metformin, and then only in their after 5 years they use now dual therapy. They are put on a second drug, and then maybe after about 15 years they start insulin, or 20 years they start insulin. That's very good. That's very good. That shows that this patient's diabetes. And also, if you can be on that drug for a very long time, it means your blood sugar is controlled, and most importantly, disease progression has been delayed. So you won't quickly get into the complications of the diabetes, right? It happens that sometimes a patient is diagnosed with diabetes for the first time. That year they are started on metformin. Within 6 months they're already on a dual therapy. Within that same year they end up injecting insulin. It shows the disease progress stays very fast, and most likely the diabetes is contributing a lot there. Because I mean, when you come to a doctor, he does his check the blood sugar, he does his HbA1c, it's elevated, he's gonna add a second drug because he can see that if I don't act, this patient is going to get into the complications of the diabetes, because a high blood sugar that is chronically elevated, it causes complications. So to drop it down, we are going to put more drugs and more drugs and more drugs and more, and that's not good, because more drugs means disease has progressed or is progressing, and complications are just inevitable. They're just knocking, they're very imminent, and that's not what we want. So as long as you're on one drug for a very long time, being on a good diet, you can actually delay having your doctor add more drugs, and all of that. And also, when you find a patient who's on insulin and they're injecting 40s, they're injecting 50s, you know, poorly controlled diabetes, right? I'm saying 90% of the patient who's got poorly controlled diabetes, it's because of diet. Yes, there are things like stress, there are things like infections, but you don't have a chronic, most people don't have a chronic infection. You go with the UTI, it's treated. You go with the pneumonia, it's treated, and then that's it. You've got a fungal infection, it's treated, and then it goes. Yes, I know there's stress and all of that, but make sure that your diet is under check, is in order. That's how you can delay the disease progress and actually delay the complications. A patient who is diabetic, it's not a must that they must die because of the complications of the diabetes. There are people who die from other things, not even the complications of the diabetes, and late in their lives. You see? So I don't know how I can emphasize this issue of diet. It's very, very. We are going to talk about the impact of a diet of a good diet for diabetic patients, right? Yeah, let me just clear this and then we can move on to the second part.